So the Cannabis Industry Council, the idea is to bring all of industry together. So it's not just about prescriptions and medicinal cannabis. It's not just about CBD. We've also got hemp as well. So we've got a hemp group as well. We've got a CBD group. We've got prescription cannabis. We've also got looking at environment subgroups as well. We're also looking at the standards there. So we're putting papers together, and there's been some fantastic papers by one of your colleagues being put out, Guy, which I believe was on the podcast a couple of weeks ago. About driving and being a prescription patient and your rights as a driver, and the fact that intoxication, the difference between being intoxicated to actually drive, unable to drive, and being able to have a prescription and the amount that is actually within the blood, which isn't an indication of intoxication, blood THC levels. So we've got a paper on that out. We've got a paper coming out that's been published on the economic values of the use of cannabis. So we're trying to bring the research together that the government is so desperately telling us that they need, and the evidence. So from whatever area, we've got an international group as well that's, looking around what's happening around the world and how their models around the world have actually worked and how they haven't worked, and what we can learn from that as well. So we're a whole array of things, and it's an industry body. We've got a students membership as well, so people who just really want to know what's happening for the networking events as well. It's a new role to me. It's the first time I've ever been a chair of an association, and a bit of a steep learning curve at times. Definitely some steep learning curves of sort of bringing people together and making sure everything is best for everyone within the industry, not just one sort of area, not just focusing on the medicinal side of things. Cannabis is so much more than just a medicine or just a building material. There's so much more to it, and that's what we're sort of trying to bring to the forefront with the Cannabis Industry Council, and bringing industry together and patients so that everyone can communicate together as well and understand the needs of each, because industry's needs and the actual things that industry needs to hit are different to the needs of a patient. So large scale production is very, very different to small scale production that many of the patients may have been used to. And it's understanding those needs and those methodologies that are involved in that, a lot of the red tape, and being able to sort of educate one another as well. And it's about bringing a unity so that we are a unified voice as opposed to individual voices.
Yeah. I have my appreciations and my qualms with the CIC, as I do with any organization. I feel slightly better with yourself at the helm, or joint at the helm. I see the need, obviously, for a kind of fragmented approach to things. The one thing that I guess frustrates me most is kind of the absence of like a legacy group in the CIC, because everything that you have mentioned there is built on good old-fashioned dealers, good old-fashioned home growers. The people that went kind of before that, I feel they're left voiceless even by these attempts to give voice to the community because of their perceived criminality, even though the point of this surely should be to end that criminality, not to create a, frankly, middle-class pathway to participation. Do you know what I mean? It feels like there's a limitation there. And again, I understand why the CIC is limited to it, because of the disparate opinions of the parts that make up the sum total of the organization. But yeah, I guess that's my only kind of frustration with it. I think it is, as you say, a good collective voice for channeling information and kind of, let's call them demands towards, Parliament and to the kind of established systems that govern us. So I think in that sense, all power to it. I think there is a bit of an oversight. There was an anecdote somebody was telling me not that long ago. There was some product in the 1980s, and I can't remember what it was, and it was designed, conceived, marketed, and mass-produced by men, and it was for women. And the first woman that got her hands on it went, "Women don't fucking use this," and they lost everything, and they'd never consulted a woman along the way. And I can't help but feeling like the CIC not having an open area that allows for not condoning, but allowing those conversations of what is to exist alongside this. Otherwise, the industry will build its model, and there's this huge missing piece. And it's go on.
I have to disagree with you because I think I helped to stop that, because obviously coming from that side of things, I hope that I'm a voice for that as well. Looking at the international group, we are looking internationally what is happening and how models there for adult use is being set up, and no model is going to be perfect. And a lot of people you do find as well that are within the industry themselves do come from the legacy side of things and have actually moved over. I mean, that's not as apparent as you would like to see that, but I do think that voice is still there. And I don't think it's being forgotten about. The issue is it's still illegal for adult use within this country. And, that's not for us to debate at this point in time. But I'm hoping things will shape out better so that we can get the patients sorted first. I think there's and just an acceptance that this is a medicine and it's not just a recreational drug as well. I think we've got to position cannabis being useful for everybody, not just for people who want to get high, which there's nothing wrong with that. I'm not condoning that, but in order for us to be able to move things forwards, we've just got to position this in a different way. And I understand with the analogy that you're giving about that something was designed for women and women don't use this. I do think there are voices within there that are making sure that they are being thought about. Me being one of them. And hopefully I can prove you wrong. Yeah, I hope I prove you wrong.
I challenge you to do so, and I hope so.